think a lot of people have that misnomer of, oh, I have back pain and I'm just going to go in and get adjusted and get fixed, and basically then they're just going to go on. But there's so much more that goes into the work that you do to treat patients, and it is truly that all-encompassing aspect of trying to keep people healthy through your care. But I think that new patient coming in, there are some things that I wanted to ask in regards to what they can expect. So I think it's more about, now you have the new patient's attention, they're there for all the right reasons, not just for the quick fix. But they're their first time. What can they expect? They are going to, of course, probably when they're getting realigned. I know a lot of people use the terminology, which I know I've been corrected over the years, like, oh, I need a good crack. Well, it's not really the getting cracked. It's
right.
more of the adjustment and the alignment. So they're going to hear things moving, popping. They're going to feel things. I'm a new patient. What do I expect when I come into your office?
That's a great question, because so many of you out there have never maybe been adjusted or have never been to a chiropractor. So what an opportunity to fulfill your curiosity. When somebody comes into the office and you move your knuckles and you hear that sound, or if it's in the neck and you hear that sound, a lot of people say the word crack because it sounds like a crack.
Yep.
But the truth of the matter is that when you move your knuckles or you get a proper chiropractic adjustment in the neck, the mid-back, or the low back, that cracking sound actually has nothing to do with bone at all. What it is in between each, there's nowhere in the body where bone actually touches bone. There's always a synovial joint between the long bones, or in the vertebrae, it's a disc. Looks like a little gummy bear in between each bone. And when you properly put the bone back into position, there's a gas that's released from the disc space, and that's that actual noise that it makes.
Okay.
Now, some people that are apprehensive, or they're just not comfortable with that type of adjustment, we do different type of adjustments where we just put about this much pressure, just want to give you an idea how comfortable it is, on the actual bone in the top part of the neck or the lower part of the spine, that doesn't get that noise, but it kind of accomplishes the same thing.
Okay.
So truth be told is, I tell people when they come in my office, for instance, say a young lady's name is Mary, I was like, Mary, how I'm going to check your spine today and how I'm going to adjust you is going to be different on how I adjust you next year. As a matter of fact, I joke with my patients and I say, look, we grew up in South Jersey, so we have that South Jersey feel. I said, if I adjust you next year the way I adjust you on your first couple times, you're going to look at me and like, Doc, what are you doing? It's not my first time. Hook me up. Mm-hmm. So we're very cautious with people in the beginning. We know it's their first time. What they can expect to feel if they have misalignments from physical stress, emotional stress, and chemical stress. They can feel like this uplifting of energy, sleeping deeper. If they sleep deeper, they wake up with more energy. We have so many cases where people come in with anxiety, and it's just us growing up, we've never heard of anxiety. Now all of a sudden everybody has anxiety, right? Yeah. So when people get adjusted and the signals from the brain come down the spinal cord and get to the body without interference, the person it's just they get more relaxed, they sleep deeper, they're more comfortable, they're more carefree, and that's why most of our patients are with us long term.
Okay. Are we talking this is every month? Are we talking every week? Or are there differences in regards to the person that you're treating? Does that drive how often they would come in terms of frequency?
That's a great question. So somebody that's in a car accident, okay, they get into this motion and they go all the way back and all the way forward. When they come into my office, because the muscles went into spasm and it's pulling on the, by the way, when you get into a car accident, you're better off to see a chiropractor sooner than later.
Okay.
You don't want with the muscle relaxers and the different things that the hospital gives you, you don't want your muscles sitting in an abnormal position. It'll pull your spine, put tension on the spinal column, and then there's a lot more work to be done.
Okay.
So in that particular situation, I would see somebody maybe 3 times a week for a couple weeks and then evaluate. 2 times a week for maybe a month and then evaluate. Okay. 1 time a week for a few months and then evaluate. And keep open lines of communication with the patient. How are you making out? How are you sleeping? How are your pain levels? somebody comes in that's not in a car accident and they have like a digestive issue. We check the spine to see where the misalignment is, and then we ask a lot of questions.